Network that Survivalist Radio is on. I've had them on my show as guests a couple of times. They're incredibly informative. They're also urban homesteaders, and they're currently pursuing their Master Gardening certification in the state of Florida. This is going to be a really informative session, and I've been really looking forward to having them here and hearing them speak. So without any further delay, let me introduce Dr. Bones and Nurse Amy.
Yay! Well, I'm Dr. Bones, and this is Nurse Amy, and we host the Prepper Survival Show on the Prepper Podcast Radio Network, along with Ed. Thank you, Ed, for that wonderful introduction. And we talk about medical preparedness and growing food, and we talk about natural remedy. What are you doing? Natural remedies, and we talk about the philosophy of doom and bloom. And for us, that's basically that we know that things are dangerous, but with danger comes opportunity. The opportunity what we have to learn skills, things our forefathers knew that we lost somewhere along the way. And you know what? It's a challenge, but we can do it. And if we can do it, you sure can. Now, I have to tell you, as a legal disclaimer, that the information we're giving you today is for educational purposes only and does not constitute medical advice for anything but a post-apocalyptic setting. So if you need a brain transplant, there's a hospital and a brain surgeon over there. Please don't try to do it yourself. That would be greatly appreciated. Now, we have some slides that are going to be disturbing to children and to sensitive individuals. So be forewarned. We're also going to leave some time at the end of the session for questions. We're going to be here all night, and so please save all your questions if you can until the end, and we will answer them. There's not going to be one question that we're going to leave unanswered.
That's because we had about 5 hours of information in 90 minutes.
You know what? We're not going to turn you into doctors after this talk, but you know what? After this talk, you'll be more of a medical asset to your community than you are now. And that I will guarantee you. Now, the title of our talk today is Collapse Medicine. You don't really hear that much. Usually you hear, survival medicine. You hear wilderness medicine. So what's the difference? Well, I define survival medicine as the medical care that's rendered in a situation where modern medical facilities are not readily available. This I would take to mean wilderness hikes, ocean voyages, trips to underdeveloped countries, things like that. There are doctors, there are hospitals, they just don't happen to be where you are at the time that the medical care is rendered. Now, this is different from collapse medicine. The primary goal in survival medicine is to stabilize the patient and evacuate the patient to the nearest modern medical facility, even though it may be hundreds of miles away. Well, in collapse medicine, the question is what medical modern facilities? They've all been blown up. They don't exist anymore. And so what does this mean? This means that the buck stops here, that you are the end medical provider for that injured person. And this is something that is way beyond what the expectations of the public are. In various surveys, 50% of the public expect the government to take care of and protect them. Yet in Philadelphia, Pennsylvania, in various police precincts surveyed, 55 to 65% of police would not report in a collapse situation. In Frederick, Maryland, in various fire stations surveyed, 30 to 70% of the firefighters would not report in a collapse situation. 60% of people expect to rely on first responders to help them in the early going. Yet in Montgomery, Alabama, 35% of able essential workers, EMTs, nurses, other essential personnel, able, healthy, would not report. More amazingly, 52% of people expect their employers to take at least partial responsibility for their care. Yet few employers have any kind of contingency plan whatsoever for their own families, for goodness sake. So what does this mean? It means that you will be responsible for your medical well-being and that of your loved ones in a collapse situation. Now, what's the first thing that you can do to assure your medical well-being in a collapse? Don't be a lone wolf. Now, that's a funny picture to pick for this slide. Does anybody know what that is? Raise your hand. Sir.
Thracian.
That is a Thracian, otherwise known as a Tasmanian wolf. Very good. Not only knew what it was, but he knew the scientific name for it. Now, why would I pick a picture of a Tasmanian wolf for this slide? Does anybody have any idea, sir? You're darn right, and so will you be in a collapse situation if you try to go it alone. You know that even if it's just your extended family, that you need a survival group if you're going to have any hope of keeping it together when things fall apart. You're going to be chopping wood, you're going to be gathering food, you're going to be growing food, you're going to be doing things that you haven't done before. It's all going to be taxing. If you go it alone, it's going to be plain old hazardous to your health. So, you know what? Places like this are a great place to network and find yourself other like-minded folk. Get some plans together, have meetings, set priorities, get Plan A, Plan B, Plan C together, make them operational. What's the second thing you can do to assure your medical well-being in a collapse situation? And that is to get healthy and fit before a collapse happens. You've got goals. They are maintain a normal weight for your height and age. That ain't that easy, especially for folk like me. Get good nutrition, eat well, keep fit. This polar bear recommends yoga to keep fit. And you see, I mean, look at that. He's got a six-pack. Wow. Got bad habits? Well, dump them. How are you going to function in a collapse situation? I'm standing on something that's causing that to happen. All right. How are you going to function in a collapse situation if you smoke and your stamina and fitness are continually being tested? And, of course, take care of your chronic medical problems. Now, when there is no doctor, somebody in the group has to be designated the medic. My hope is that this talk will help some of you on the way to becoming the medic for your either family or group or extended survival community. Your job is going to be to coordinate the accumulation of medical stores. You need to obtain medical knowledge. Not only do you need to know general first aid, you need to know first aid for emergencies, and you're going to need to know some of the stuff that we're going to talk about later in this show. You need to know anatomy. Anatomy is the blueprint of the body. Physiology, I know I didn't touch anything that time. Physiology is the operating manual, and that's how things function. Now, if you know these three things, you're well on your way to becoming a successful medic. Another attribute of a good medic is the ability to cross-train his people. You need to be able to share that medical knowledge because guess what? One day the medic's going to need a medic. Now, the first thing that the survival medic or collapse medic needs to do is perform a needs assessment. You have to ask yourself the following questions. What are your responsibilities? Well, goes without saying you're the chief medical officer of your community. However, besides being the healthcare provider, you're also the chief sanitation officer. It's up to you to make sure the conditions at your camp are not going to cause disease to become rampant in your people. You need to be the chief dental officer. You know, in Vietnam, there were as many dental sick call patients as there were medical sick call patients. So you're going to need to know some dental stuff too. We're even going to talk about that today. You need to be the counselor. You know that a collapse would wreak havoc with people's mindsets. You're going to need to know how to deal with depression and anxiety as much as you're going to need to know how to set a bone or treat a cut. You're the medical quartermaster. Sure, you've got all this medical stuff accumulated and got it all stored away, but when do you use it? When do you break out some of your limited supply of antibiotics, for example? And you're the medical education resource. You are a tool for the rest of your people to learn how to take care of themselves and keep themselves healthy. Now, if you have other people in your community, say a pastor in your community, maybe they can take some of the burden of counseling away from you. If you have somebody who knows a little something about water treatment or construction, they might be able to help you keep conditions sanitary in your camp. So the bottom line is to take whatever help that you can get. Now, what scenario are you expecting? Of course, you want to have supplies that will work for every collapse situation, but there are going to be special things that you're going to be actually worried about. Are you worried about economic collapse? Well, if that's your concern, you can't expect that food is going to go from the farms to the public anymore. Who is paying the truckers? Okay, so therefore, you're going to have to learn to deal with and hopefully prevent malnutrition in your people. You may need to stockpile vitamins, even if you're not a person that wants to do that kind of thing. You might have to stockpile vitamins, either natural or commercially prepared, to prevent deficiencies in your people. Are you worried about civil unrest? Well, you sure as heck better know how to deal with traumatic injuries. Are you worried about a superflu descending on your area? You better have extra gloves, you better have extra masks, you better have extra antiviral drugs like Tamiflu. You're worried about a nuclear meltdown? Well, if you're worried about a nuclear meltdown, it might behoove you to learn a little bit about how to put together a shelter that would be able to protect you from radiation. You certainly want to have some extra potassium iodide around so that you would be able to help prevent long-term damage to the thyroid from radiation, radioactive iodine. The bottom line is that your supplies and your training will vary dependent on what you are actually expecting to happen. How many people are you responsible for? Well, your 50 antibiotic pills might work for a while for a couple or a sole individual, but how about if you're taking care of 20 to 30 people? Let's say if you got a survival group of 5 families, you're going to hit 20 people, 30 people easy. So you better have more medical supplies than you thought you needed. I mean, you are going to need more medical supplies than you thought. You can never have too many medical supplies. Any medical supply, any excess that you have, if there is such a thing, are going to be highly sought after barter items. Now, what special needs do you have to take care of? You know, the medical needs of kids are certainly different than the medical needs of adults, and the medical needs of adults are probably different than the medical needs of the elderly. The people in your group have chronic medical conditions. If they do, you need to stockpile medications. Now, how are you going to do that? Let's say I have high blood pressure, and I take a pill that's 20 milligrams. I've got to take it once a day. You go to your doctor, and say, "Doctor, they make this pill in 40 milligrams. You know, times are tough. Would you consider writing me a prescription for 40 milligrams instead of 20? I promise I will take those pills exactly as you have prescribed." And get those pills, snap them in half, take your 20 milligrams, and do exactly what your doctor told you, and then you have another 20 milligrams and begin your stockpile. What physical environment are you living in? Are you going to be in a cold environment? You better know how to treat hypothermia. Are you in a hot environment? You better know how to treat heat stroke. Are you in a wet environment? You know, people that are chronically wet, they get sick. So you need to figure out a strategy to keep your people dry. If you're in a desert-like environment, you sure as heck better know where sources of good, clean water are. How long do you expect to have to provide medical care in an austere environment? You know, we have a lot of hurricanes in our neck of the woods in South Florida. We've had tornadoes here, and you can expect to be off the grid in some areas for a few weeks. But in that case, you might not need to have really varied medical equipment, like, let's say, extraction forceps to remove a diseased tooth. But if there is something that causes trouble for the long haul, you know, that equipment is going to be very, very important.